Well, the coronavirus continues to spread at speed. This time a week ago, there were under 3,000 cases in China. There are now more than 17,000 and more than 360 people have died. Outside China, there are more than 150 confirmed cases, and we now have a fatality in the Philippines too. And in a bid to contain this virus, some countries are denying entry to any people from Wuhan, the city where this virus began. And China's accusing some countries of overreacting and stoking panic. For example, it's unimpressed that the US has declared a public health emergency and is denying entry for all foreign nationals who visited the whole of China in the past 2 weeks. And if that's the Americans, this is what the World Health Organization is saying.
There is no reason for measures that unnecessarily interfere with international travel and trade. We call on all countries to implement decisions that are evidence-based and consistent.
Well, in China, millions of people are going back to work after the Lunar New Year holiday. We have these pictures. First of all, you can see people, well, these are public areas being disinfected, and we know that there have also been fever checks at transport hubs to try and spot people with raised temperatures who may have the virus. Workers are also trying to disinfect these public spaces, and China's urging an urgent appeal for more protective suits, goggles and masks because it's running low. We also have these pictures from Manila in the Philippines. There's been a rush to buy face masks there after a man from Wuhan died. And then this is Hong Kong, where hospital staff are going on strike. They want the border with mainland China to be completely shut. Well, next let's focus on the experience of being in the city of Wuhan. It remains on lockdown. People aren't being allowed to leave or come in, and those who are there are being encouraged to stay at home. We spotted this one Russian man who works there and filmed this.
Wuhan, around 5 p.m. Sunday. On the street you can see only fake people. Fake people here. Fake people there.
And remember that new hospital that was promised in Wuhan? Well, it's finished. This is a time lapse of it being constructed in 9 days. It's now admitting patients, and these images have been enthusiastically distributed by Chinese state TV. It's also been showing this graphic as well, a cartoon with the machinery involved in that construction being hailed as heroes. There are other images circulating on Chinese social media of fan art featuring these machines, a lot of it created by people stuck inside cities currently locked down. So here's one digger with a big love heart in front of it, or you've got this one here, and this one's been given a nickname, the Cement King. Now, several countries are trying to get their citizens out of Wuhan. Let's focus on Australia. These are Australian evacuees waiting for hours at Wuhan airport before eventually being flown out. 89 children were among those on board. This is the first plane of Australian citizens and permanent residents to be flown out, and this is where the plane landed, in Western Australia. But before passengers were put onto those, once they'd landed there, they were put onto smaller planes and immediately taken here to Christmas Island. It's very much known for a large immigration detention centre, which you can see there. This will be used to house the Australians in quarantine. They're expected to be there for 2 weeks. We also have these images released by Channel 7, which shows some of the medical facilities that have been put up there. You can see here an inflatable room to be used for isolating any potential confirmed cases of the virus. It's known as a negative pressure because it allows fresh air in but stops potentially contaminated air from getting out. Well, since 2003, thousands of asylum seekers have been detained on Christmas Island, well off the mainland of Australia, under Australia's refugee policy. At the moment, though, it just houses a family of 4 Sri Lankans who are fighting deportation. So the plan here is to house the Australians who've been taken out of Wuhan and house them on the island in the short term. But there are concerns, particularly about whether there are adequate medical facilities. Indeed, not all of the 600 Australians in Wuhan have chosen to leave. Here's one woman who did leave, explaining why. She said, "I got a lot of pressure from my husband. He said the situation is not very good. All the other countries have started to close the borders. He said if we stay over here, it would probably take a couple of months to get out of Wuhan. So he started to get really nervous." And she got on the flight. 4 flights carrying evacuees are now scheduled for the rest of this week. Now, 2 other important parts of this story are misinformation and racism. We spotted this post that's been widely shared in Australia, supposedly from an organisation called the Department of Diseaseology Parramatta, except that it doesn't exist, and the information in it advising people to stay away from suburbs with large Chinese populations is baseless. So I saw this from a doctor in Australia. She tweeted, "A patient made jokes about not shaking my hand because of coronavirus in front of my team. I've not left Australia. This is not sensible public health precautions. This is racism." Well, on misinformation and conspiracy theories around the coronavirus, here's Will Summer, a tech journalist from the Daily Beast.
We're seeing a lot of these fake claims, whether it's, drinking bleach to ward it off or the idea that this is spread from Chinese people eating bats. These frankly, many of these ideas are frankly very racist that are blowing up on social media. So it's tricky. We've seen some tweets from even epidemiologists, people who are experts in this field, get taken out of context and really blow up online by people who are, very concerned about coronavirus. The solution, I think, is very responsible reporting and people really, going to the experts on this rather than sort of seeing what's going viral and running with that.
Well, we saw this article by a journalist called Angela Hoy, written in the Metro newspaper. In this article, she highlights some of the media coverage she's taken exception to. For instance, this is the Herald Sun in Australia. It has the headline, "Chinese virus pandemonium," with the word panda highlighted. And she's also written about her personal experiences here in London, in particular, one incident on the Underground.
A white man about in his 20s, 30s, sits down next to me and then immediately shoots back up and gets up and then mutters under his breath "Oh, I'm not sitting next to coronavirus," and then goes across the carriage and then sits somewhere else. And at the time I was just kind of taken aback by it, did that really just happen? And not really thinking too much about it, and didn't really say anything at the time because I was a little bit in shock, and also I didn't really want to kick up a fuss about anything because it's this. Yeah, I think that's what happened.
And now you've shared this story, have other people come to you and said, "Well, actually, I've experienced something similar"?
Yeah, actually, quite a few people have experienced the same thing. The problem was when the coronavirus broke out, it was around Lunar New Year as well, so a lot of people weren't allowed to go back home and visit family because a lot of people were on lockdown. And it was quite sad as well in Chinatown. Many people in Chinatown,
in London.
Yeah, London, Chinatown. A lot of people didn't, were avoiding the area because of, fear over catching something or catching coronavirus. And another girl that I spoke to, she was also on the tube, and then she saw a man, she witnessed a man holding a newspaper, and then there was a group of East Asians that just got on the tube, and he was just using a newspaper to cover his face and like this kind of thing, getting away from them. And then as soon as they got off the tube, and he just kind of relaxed, and it was just this. I think it's just kind of really sad that everyone's being lumped together. It doesn't really matter if you're East Asian, Southeast Asian. Everyone's kind of lumped together. It doesn't really, regardless of whether if you're Chinese or not, which is the sad thing, I think.
And in your article, you weren't just talking about your personal experience, you're also highlighting some of the media coverage that you've taken issue with. Have you been surprised by the tone that you've seen in some newspapers?
To be honest, I'm not that surprised because I feel like a lot of East Asian discrimination is just not really reported on, and it's often ignored. And I think these scaremongering headlines are just, thinking the worst, and it's making everyone think irrationally and do irrational things. And it's just, causing up a frenzy where everyone's just scared. And I think it's just very unfairly the way that everything's being reported.
And there's much more information on the coronavirus via the BBC News website.